Pulmonary fibrosis is a disease that causes scarring of the lung tissue. The scar tissue makes it more difficult for the lungs to work properly, which can cause a number of symptoms such as shortness of breath, coughing, and fatigue. In this video, we'll take a closer look at pulmonary fibrosis, including its symptoms, causes, and latest treatments. So, stay tuned till the end. Hi! Welcome back to our channel! Don't forget to subscribe to our channel and press the bell icon to never miss an update on the latest medical knowledge. Pulmonary fibrosis is a disease in which the lungs develop scar tissue. This scar tissue makes it harder for your lungs to work properly, which can make breathing more difficult.
People with pulmonary fibrosis may experience symptoms such as shortness of breath, coughing, and fatigue. In addition, pulmonary fibrosis can also cause other problems such as heart failure and respiratory infections. There are many different types of pulmonary fibrosis, but the most common type is idiopathic pulmonary fibrosis.
As the name implies, idiopathic pulmonary fibrosis is a type of pulmonary fibrosis that occurs without any known cause. Other types of pulmonary fibrosis can be caused by exposure to certain toxins or viruses, but idiopathic pulmonary fibrosis has no known cause.
The symptoms of pulmonary fibrosis can vary from person to person, but some of the most common symptoms include shortness of breath, especially during physical activity, a dry cough, wheezing, fatigue, and weight loss. In addition, people with pulmonary fibrosis may also experience symptoms such as chest pain, fever, and chills.
These symptoms can be mild at first, but they can become more severe over time. If you're experiencing any of these symptoms, it's important to see a doctor right away. Early diagnosis and treatment of pulmonary fibrosis can help prevent the disease from progressing and causing further damage to your lungs.
Idiopathic pulmonary fibrosis is a rare disease, affecting about 100,000 people in the United States alone. It is more common in men than women, and the average age of onset is 65 years old. The exact cause of idiopathic pulmonary fibrosis is unknown, but it is thought to be caused by a combination of genetic and environmental factors. There is no cure for idiopathic pulmonary fibrosis, but there are treatments available that can help improve symptoms and slow the progression of the disease. One of the main goals of treatment is to relieve the symptoms of pulmonary fibrosis, such as shortness of breath and fatigue. This can be done with medications such as diuretics, which help to reduce fluid retention and make breathing easier.
In addition, medications such as anti-inflammatories and immunosuppressants can also be used to reduce inflammation in the lungs and prevent further scarring. Another important aspect of treating pulmonary fibrosis is providing oxygen therapy.
People with pulmonary fibrosis often have low levels of oxygen in their blood because the scarred lung tissue makes it difficult for the lungs to exchange oxygen and carbon dioxide effectively. Oxygen therapy can help improve blood oxygen levels and relieve symptoms such as shortness of breath.
In addition to medication and oxygen therapy, pulmonary rehabilitation is also an important part of treating pulmonary fibrosis. This is a program that helps people with lung diseases such as pulmonary fibrosis to learn how to manage their condition and improve their quality of life. Pulmonary rehabilitation typically includes a combination of exercise training, education, and counseling. For some patients with pulmonary fibrosis, a lung transplant may be an option. This is a surgery to remove the diseased lung tissue and replace it with healthy lung tissue from a donor. Lung transplantation is not a cure for pulmonary fibrosis, but it can significantly improve the quality of life for many patients. There is currently no cure for pulmonary fibrosis, but there are clinical trials exploring new potential treatments. One of the most promising areas of research is in the use of antifibrotic medications. These are drugs that can help reduce the amount of scar tissue in the lungs. Several antifibrotic medications have shown some success in slowing the progression of pulmonary fibrosis.
And researchers are hopeful that one of these medications will eventually prove to be a cure for the disease. Another area of research is in the use of stem cell therapy. Stem cells are cells that have the ability to develop into many different types of cells. Researchers are investigating whether stem cells can be used to repair the damaged lung tissue in people with pulmonary fibrosis.
Some small studies have shown that stem cell therapy can improve lung function in people with pulmonary fibrosis. However, more research is needed to confirm these results. We understand that living with a chronic illness like pulmonary fibrosis can be challenging, which is why we've created a supportive online community for patients and their caregivers. Our community is a safe place where you can connect with others who understand what you're going through. You can share your experiences, ask questions, and get support from others who know what it's like to live with pulmonary fibrosis. We hope you found this video informative. Please let us know if you have any questions or comments down below. We value your input and are here to support you in your health journey. Stay healthy and take care!